Hi, our news conference will start in just a few seconds. Good morning, and thank you for joining us for the City of Lubbock COVID-19 news conference. We are so excited and fortunate to have a very amazing panel today. Today's all-women panel will offer insight into the pandemic from the perspectives of frontline medical workers who are also moms and caregivers at home. So today's panelists are Catherine Wells, Director of Public Health, Dr. Jessica Gray, Family Medicine Specialist at UMC, Dr. Amy Thompson, Pediatric Hospitalist with Covenant Health, Dr. Brittany Bankhead Kendall, Trauma Surgeon with UMC, and later Brooke Witcher, an Assistant City Manager with the City of Lubbock, will join us for media questions. So let's get started with Catherine Wells.
Thank you, Lacey. I'm really excited about our panel here today. And before we bring them all on, I just want to give us a quick update of where we are with our COVID numbers and our COVID case counts. In watching the pandemic, there's really three metrics that us here at the health department are paying attention to, and that's our hospitalizations, our daily case counts, and immunizations. As of last night, we had 193 people in the hospital with COVID, and our hospitalizations have been hovering around 200 people per day for about 2 weeks. So it's good that we haven't seen a large spike, but that is a lot of individuals with COVID in our local hospitals. And as we've seen nationally, over 90% of those hospitalized are unvaccinated. And then those few people that are vaccinated that have to go into the hospital, we're seeing a much shorter length of stay, and they really don't need as much additional care after discharge. We're also seeing a younger age group in our community in the hospital, and that can be of some concern, very different with the Delta variant being here than what we saw previously. For COVID cases, we're averaging around 300 new cases per day. And this is more than double than what we were averaging at the beginning of August, where we were only seeing about 130 cases a day. So we're really still seeing significant transmission in the community. And I want to remind everybody to follow those public health guidelines. We really do encourage wearing a mask when you're out in public, and making sure that, we're doing washing our hands and other good hygiene practices. Really, our current case count right now is being driven by the younger age group, and 48% of our current case, or the new cases diagnosed over the last 2 weeks, are under the age of 25. Vaccines are so important right now, and it's even more important with the Delta variant. We're seeing cases in young people, and I really want to encourage all of our young individuals to get vaccinated. In Lubbock, 50% of our community is vaccinated, but only 35% of those 12 to 25 are vaccinated, and we need to get that group vaccinated. To continue to make vaccines easy to obtain, we're hosting 2 big health vaccine clinics with the health department. The first one's going to be on Saturday, September 18th. We'll be at Lubbock High School from 10 to 2. You don't have to be enrolled in Lubbock ISD. This vaccine clinic's open to everybody, but we really do want to target those 12 to 18-year-olds. So please bring your children to Lubbock ISD or to Lubbock High on Saturday, and we'll be providing vaccine. Also at that clinic, we'll be providing childhood vaccines for those who are 4 and over. So if your kids are behind on those vaccinations, please come out and we can give those childhood vaccines also. And then another event that I'm really excited about talking about is the health department, along with staff from Covenant and staff from Lubbock Fire and Rescue, will be at the South Plains Fair. We'll have a vaccine clinic every day of operation from September 24th to October 2nd. And if you come to the fair and get vaccine, whether or not it's your first dose or second dose, we're going to give you 20 carnival ride tickets. So you can go enjoy the fair with your family and go take some rides at the carnival. Great time, really great time for everybody to spend together. And if you're not vaccinated, I really urge you and your family to come out to one of these clinics. It's easy. You don't need an appointment. You only have to fill out one piece of paper and we will get you that vaccine. With that, I will pass this over to Dr. Jessica Gray.
Hi, good morning. My name is Dr. Jessica Gray. I'm a board certified family medicine physician and I work for UNC. I was asked to speak today as part of this panel of women in medicine who feel passionately about supporting other women in our community as a whole during this pandemic. I've been treating COVID on the outpatient level daily since the beginning of this pandemic. Back when we started in a parking lot in UNC and doing those swabs and trying to figure out what's going on and if it came to Lubbock. And simply put, COVID has really changed the way we all practice medicine. My biggest role in this fight is to educate about prevention. Being in the outpatient level, I see patients coming in clinic every day, and that's really where we have the biggest discussions about this. After everything we've learned about treatments for COVID, all of the information going back and forth about what drugs to use and things like that, it really comes down to the fact that preventing the infection is the most effective option we have. I spend hours every day talking to patients about how to prevent infection. And when I counsel them on prevention of COVID, specifically, I talk about the vaccine. There's a lot of misinformation about COVID and the vaccine. I talk with patients to tell them it's okay to be confused, it's okay to have questions, it's okay to have concerns about vaccine safety and side effects. That's what we as your doctors are here for, to talk to you about. I know many of our patients are seeing a wealth of negative messages regarding what will happen if you don't get the vaccine and a lot of scary stuff. And sometimes it's easier just to tune it out. When the news sounds scary, we just turn it off. But what I want to focus on is the benefit and the positive things that happen when you do get vaccinated. When you do contract the illness, your symptoms are far milder. I've seen plenty of patients who have been vaccinated, and if they do pick up that Delta variant, their symptoms are a little bit of a sniffle. Sometimes they just think they have a little bit of a cold or a sinus infection and it passes. You can feel more confident being in public spaces when you are vaccinated, going to the South Plains Fair, going to the mall, all those things, seeing family members. When we're vaccinated, we know that we have that added layer of safety and protection. As a vaccinated parent with small children who are unable to receive the vaccine, you'll feel more assured that you're doing what you can do to protect them. And that's something that's really important to most parents out there. I think the mistake sometimes people in healthcare are making when it comes to talking about the vaccine is not allowing patients to have these concerns and feelings and talk to them and let them feel validated. The two biggest myths that I hear on a daily basis are related to two things. One, how fast the vaccine was developed, and two, the idea that you don't need the vaccine if you've already had a COVID infection. I'll talk about both of those really quickly. The technology used to develop the COVID-19 vaccines is not new. It has been researched for decades, and it was tested and approved with the same scrutiny as other vaccines that we give to our children daily, give to our family members, and we take and understand their safety. Increased funding allowed vaccine developers to work more quickly during the pandemic. We talk about things like cutting through the red tape. The red tape really is what limits us on how fast we can go with this technology. The other question is the idea that you don't need the vaccine if you've already had COVID. It's currently not clear how long natural infection provides immunity, and reinfections have been reported. I've had plenty of patients that last year had COVID within the 2020 year, and then unfortunately didn't get their vaccine and they got reinfected with the Delta variant and had severe complications. I've even lost a few patients in the hospital from those complications. It's recommended to get your vaccine about 90 days after an actual infection with COVID. For me, this is personal. There's a lot of misinformation about women in the vaccine right now. As a woman and a physician, I'm especially concerned about this. And I want to make sure that everybody has access to the appropriate information, not the stuff that we look up on YouTube or blogs or Facebook or things like that. As a new mom to a 5-month-old son, who I also nurse, I'm especially important to me that we talk about vaccine safety because I care about the safety of the vaccine for not only me, but also my son. After research and guidance personally by my OBGYN and pediatrician, I made the choice to be vaccinated, as I know it not only protects me, but I also can pass on antibodies to my child to protect him. The biggest thing that I want to say is that it's okay to have concerns about the vaccine, but you should get your answers from reputable sources. It's not the internet most of the time. And it's okay to have questions and not trust some of the other sources and big government or whatever we're talking about, but trust some of your experts locally. This panel of women here today are respected members in the community, many of them doctors in the health department, things like that. and they have a wealth of knowledge about COVID and vaccination. So that's all I have to say. I think Dr. Amy Thompson is next.
Awesome. Thank you. That was fantastic, Dr. Gray. Thank you. I agree with, this is where I want to say I agree with everything that she just said. So fantastic work on that. So my name is Dr. Amy Thompson. I am a board certified pediatrician. I'm actually a pediatric hospitalist. Hospitalist just means that I have spent my career taking care of sick kids in the hospital. I also wear the hat of the CEO at Covenant Children's Hospital. And at the Children's Hospital, we take care of both women who are having babies as well as children. So throughout this pandemic, I've had a couple of different vantage points. One as the administrator of a hospital that's been affected by this pandemic. And then the second, obviously, is as a physician. And actually, I was on as the pediatric hospitalist this last weekend for a 4-shift stretch. And so I had an opportunity. I took care of all of the COVID kids that we have here in the hospital. So really what I wanted to talk about today, a couple of different things is, number one, what is happening with COVID in kids, and what is it that we are seeing, especially in that inpatient space? Like how are we being affected? So certainly what I would say is, since the beginning of the pandemic, we've been very blessed that COVID has just affected kids differently. And when you look at like overall hospitalizations, if you take a look back whenever COVID first hit and kind of follow through 2020, the percent of all hospitalizations for COVID in children were about 1%. And when I look back to the last wave that we had prior to this, really what we were seeing is a lot of what you call MISC, which is multi-system inflammatory syndrome of children. And it's kind of this inflammatory thing that happens after an active COVID infection. And we were really seeing a lot of that with this last wave. What I will tell you that has changed in this current wave with the Delta variant being predominant is we first have seen an increase in the percentage of pediatric hospitalizations across the United States. Now, that number is still relatively low, so it's still less than 2%, but is definitely higher than we saw with the previous wave of patients. And I would also say that those patient demographics have changed a little bit about what we're actually seeing in the hospital. There was a point this weekend where the total number of COVID patients that we had at Covenant Children's was 15. And I do know that University Medical Center had some children as well. So that's not the totality of all of the pediatric cases. That number is higher than we had seen, and it's been a more sustained admission number that we've seen than the previous wave. What I will tell you is, right now, the most of the children that are being admitted for COVID symptoms are actually in what I would call the adolescent range. So we actually have had a patient as young as 9, and obviously we take patients up to 18 years of age here at the Children's Hospital. The difference that I would say is what we're actually seeing right now is a lot of what I'm referring to as acute respiratory COVID. And so it's more consistent with what you think about in adults as the respiratory symptoms that are coming with COVID. And certainly it's the patients that we are seeing most are in that adolescent range. I've been asked the question, probably the biggest question that I've been asked is, yeah, but isn't that all the kids that have comorbidities? Comorbidities mean that you have something underlying like diabetes or your weight, or maybe even, in children, hypertension, some of the same things that you see in adults. And while I would certainly say that that is true for, potentially half of the patient population that we've had in the hospital, certainly we are seeing kids who are ending up in the hospital with acute respiratory COVID who do not have any underlying symptoms. They are active children who, were not on previous medications, don't have asthma. We are seeing some of those children come into the hospital, and they're requiring large amounts of oxygen. Now, again, the number is still small when you compare that to the percentage of adult hospitalizations. But the answer that I keep wanting to talk to people about is it's not zero. It's not that we're not seeing kids that are very sick in the hospital. Some of the children that we had this weekend are intubated, which means that they are having to have, artificial means to help them, respirate themselves. And so, I mean, certainly we are seeing some of these effects in kids. When we had 15 this weekend, 2 of those were women, which we've consistently continued to see some women with COVID when they come in to deliver. But 13 of those at our highest point were all children. I think our number today is 12, with 2 of those being women. So that just kind of gives us, an idea on what it is that we're seeing. And the biggest reason that I say that is because obviously the things that are important in children is kids that are less than 12 cannot get vaccinated. Kids 12 and older are available for the Pfizer vaccine. And so I'm also a mother. So I have a 20-year-old son who is a sophomore in college, and I have a 12-year-old. And I will tell you that I've had both of my children vaccinated ever since it was available. And so I do feel like that the vaccine is safe. I agree with what Dr. Gray was saying is it is okay to have questions about vaccine. And certainly I have a lot of people asking me questions about the pediatric population. But my encouragement to you is to do the thing that Dr. Gray talked about. Go to your primary care doc, ask somebody who has been, and that understands the vaccine science and is able to talk, about the safety. I will also tell you, just kind of in closing, I am a person, you can see me sucking on this cough drop right now. I am a person that about a month ago, I was fully vaccinated. So I was one of the very first people to get vaccinated when they made that available for healthcare workers. I've had both courses of my mRNA, Pfizer vaccine. And about a month ago, I had a breakthrough case of COVID. And I will tell you that I was sick from it. And so while most people are just having very, mild symptoms, I certainly did not need to come into the hospital, but I was sick for about 5 days. And the reason that I'm sharing that with you is I kept thinking the entire time that I was ill, I just kept thinking about what this could have been like if I was not vaccinated. And so it's also true that people have been like, well, if you got sick, then why is it that, you still believe that we should get vaccinated? And the answers and the numbers at both University Medical Center and Covenant speak for themselves. And those are the same numbers and percentages that we're seeing statewide, but also that we're seeing nationally. And that is that idea that is the unvaccinated that are ending up primarily in the hospital. Catherine Welsh shared that in the very beginning. And certainly when we start looking at patients that are in the ICU and patients that need intubated, it's dominated right now by folks that are unvaccinated. So I just encourage you, I both want to encourage you as someone who takes care of kids, who, works in a hospital where we take care of women. I have children, I've had COVID. I do feel like that the vaccine is safe. I encourage you to go talk to your doctor to get good information about the vaccine. I feel that the vaccine is safe for children. And I'm excited about what I'm seeing coming down, that hopefully we will have the vaccine approved for kids less than 5. So thank you guys for joining us today. And I'm so privileged to be part of this great group of women. And so I think next is Dr. Brittany Bankhead-Kendall, and I think you're going to take it from there.
Hi, good morning. So my name is Brittany Bankhead-Kendall. I am a board certified trauma surgeon and assistant professor with Texas Tech University. I work at University Medical Center. And I'm also a surgical intensivist, which means that I work in the ICU. And I only work with adult patients, actually. I'm going to speak pretty briefly today. My experience is a little bit different than the other 2 amazing physicians you've seen today. I'm only on the hospital side, and I've really only had my interactions with COVID in the ICU. And so I've only seen the sickest of the sick. And that has really framed a lot of how I think about COVID and why I approach it the way I do. And just like the other 2 physicians you saw today, I am also a mom to a 9-year-old boy and a 3.5-year-old girl who for a lot of their adolescent lives now have seen a lot of the pandemic and what it has done to their environment and surroundings around them, and what it's done in terms of sadness of their parents for the patients that we've had and the patients that we've lost, unfortunately. And so if you ask either of my kids, do they want to get a shot? The answer will always be no. But when it comes to COVID, that answer is a enthusiastic yes, and that neither of them can wait to get their own vaccine, just like mom and dad. So the unique perspective I have, I actually started my ICU fellowship in Boston. And Boston was one, if you'll remember, way back in 2020, Boston was one of the first cities to really hit a COVID surge between there, Seattle, and New York City. And so I was very much on the front lines in the ICU, taking care of the sickest of the sick. And it was a really sad time. And there was no vaccine. There was honestly not a lot of hope for our patients. By the time they got to us in the ICU, there was a lot of scared eyes, a lot of scared families, and a disease that we really didn't know much about. And I'll tell you that now, having moved forward, we know a little bit more about this disease, and my fear of it and my sadness about it has only grown, honestly, since that time, because more and more we're seeing the intermediate and potential long-term effects that it can have on our patients. And so now more than ever, I am just such an advocate for this preventative measure, like Dr. Gray was talking about earlier, because that is really the only thing that we know that can prevent this from happening. And when I say prevent this from happening, I mean, ending up in the ICU and needing that breathing tube that was talked about earlier, but also, long-term and what that looks like down the road. We just don't know. We don't have it written in the books yet, what that might mean in the future. So I think prevention absolutely is the most important thing. I personally, I'm a woman of science, obviously. We all are here. We're very much dealers in black and white. And so I personally read the document that was publicly available for my own vaccine. I was not about to take a vaccine I didn't fully believe in. It's something that I put in my body. So I wanted to make sure that I understood it and could follow the graphs and the science and the data. And I was very impressed. So know that those are publicly available to you. If you ever want to read that for yourself, you can go straight to the horse's mouth, for lack of a better term, and find those. Those are always available. And then if that's hard to follow and if it's hard to go through, like it was said today, talk to your physician, talk to your PA, your healthcare provider, whoever it is that you trust emphatically whenever you're sick with anything else, whenever you need a medication refilled, whenever you need advice, whoever that person is, go to that person and ask about their opinion, tell them, and be honest about your fears too. I certainly had fears and concerns, and so I found out for myself, I addressed all of those in that document for me. But then if you're not sure, and if that still doesn't really make sense to you, be honest about that. We will never judge you. We will never think ill of you. We will never, swipe that away as, inconsequential. It's important to have all of your questions answered. Really, really important. So I'll just close this out by saying I don't know if anyone else here does, but I have a lot of social media profiles on Twitter and Instagram and Facebook, and it's publicly viewable. So you see my name here. I've offered before on all of those platforms to anyone that I'm friends with to reach out. It will be a judgment-free zone. And at the end of the day, all we want is shots in arms. And if you want to reach out and ask questions, whether it's me or someone else, I'm always happy to answer them. And I know anyone else here would be too. So just shoot us a message or set up an appointment with your own doctor.
Thank y'all so much. And now we're going to open it up for media questions. So if our panelists would turn on their videos, we'll get started with questions. To keep things running in a timely manner, we're only going to allow the media to ask one question. I will mute you after your question. There will be no follow-up, but if there's something else you would like to know, please, media partners, reach out to me and I will try to get you your answer. So here is today's media question order. It will be Matthew Stell with KOBK, Rob Avila with Texas Tech Public Media, Olga Aguero with El Editor, Elizabeth Fitz with KMAC, Christy Martinez Garcia, Latino Lubbock, Ashley Cantu, The Daily Toreador, and Addison Barthold with KCBD. So let's get started with Matthew Stell with KOBK.
Lacey, thank you very much. It's good to be back on one of these calls. It's been a while. My question is really for the entire panel. It may be specifically for Catherine Wells or Dr. Thompson. We've heard about our hospitals, both UMC and Covenant, and really all across the South Plains, overwhelmed, overworked, exhausted, inundated with COVID-19 patients, especially those in the ICU. Many of those are unvaccinated. We know that our hospitals and healthcare systems are short-staffed, and our Grace Morris did an incredible story last night on KLBK about some beds having to be placed offline at Covenant because of the struggles there. So this may be a rhetorical question, but what can be done about this? Is there any sort of turnaround in sight, or is it something that we're going to have to deal with and work through until the numbers get better?
I'll start off and then I'll pass it over to Dr. Thompson probably. We are definitely in a surge with COVID right now. Some of the projections show that surge will hopefully start subsiding soon. But in order to get through that, we need people to follow all of those public health recommendations, and we need everybody to get vaccinated, especially our 12 to 25-year-olds where we're still lagging behind. And those are the two key things that are going to get us through the surge and hopefully keep the numbers down in the future. Dr. Thompson, if you don't mind.
Yeah, what I would say is certainly what's been true at both University Medical Center and Covenant in the adult arena for the entirety of COVID has been that those hospitals have been, during the surges, very, very full of COVID patients. And you can see the things that have happened across, the entire nation, and it's no different than folks here. I especially have a heart for folks who have had to do adult medicine in these last number of COVID surges, just because, especially early on, it's not just the amount of patients, but also just the overwhelming nature of both the morbidity and the mortality, which just means patients still leaving the hospital very sick or, passing away from COVID. And I think that's just been overwhelming for the staff. What we're seeing right now in children's during this wave has been different than the first two waves. If you actually look on the Texas state numbers, they are now looking at PICU beds. So I will tell you, for the last number of weeks, we every day are out of PICU beds here at Children's, and we're having to move patients around to try to make access for that. And that is because of the number of patients for us that are in intermediate care and ICU care. And certainly that has been true in the adult side and continues to be the adult side. I would say right now, the thing that I have is I have enough rooms that I could open up for more patients. What I don't have is enough staff. And so I think everybody is hitting these staffing issues. And you're like, why are we having staffing issues? Number one, there have sadly been a lot of people who have walked away from healthcare during some of this pandemic. So overall, those numbers are lower. But then whenever you're in the middle of a surge, you have people that are out because they are exposed to COVID or they have gotten COVID. And so that puts more stress on an already stressed, staff. What can we do about it? I feel like we'll say this 17 times during this for any question. And the answer is follow precautions, but more than anything, folks who are able to get vaccinated need to get vaccinated.
Thank you, Catherine. Thank you, Dr. Thompson. Now we move on to Rob Avila with Texas Tech Public Media.
Hi, everyone. Thank you for this. We've seen an increase in deaths the past few weeks, I think a little over 10 this last weekend. Can you talk a bit about that and what you're seeing in hospitals with this variant?
Or one of the doctors want to take that? We did see 11 deaths over the weekend, and unfortunately, there's a relationship between cases, hospitalizations, and unfortunately deaths associated with some of those hospitalizations.
I can talk just for a sec about children's, and what I'll tell you is, praise the Lord, in the last 1 year, we've only had one death from MISC in our hospital, and we've only had one acute respiratory pediatric death, but I'll probably defer to some of the adult folks for what they're seeing on the adult side.
Dr. Gray, did you want to add something?
I know Dr. Kendall actually sees them in the hospital, so she may have better ideas about this, but at least for me on the outpatient side, we're doing everything we possibly can to help patients with COVID before they get to the actual need to be in the hospital. Some of those things include the monoclonal antibody infusions, which actually have been very beneficial. But sometimes that isn't even enough. If we kind of bank on, well, if I get sick, I'll go grab one of those infusions. I hear, it works great, works for other people. We can't bank on that. That's always going to work. It's true that a lot of the patients in the hospital that have really poor prognoses or outcomes do have a lot of comorbid conditions, diabetes, being overweight, high blood pressure, coronary artery disease, CHF, the list goes on, but you don't have to have all of those things. You could just have one of those things, and that could be a high enough risk factor. But some of the patients I have lost most recently have been in their 40s. And so that's a very low age, and that's very startling to me because I've got to, I talk to these patients. I talked to one and try to convince her to get her vaccine after she had COVID last year. And unfortunately, she's got it again. And so these are these things that we need to talk about and really try to encourage our patients to not bank on the fact that something's going to happen in the ER to save them, or, oh, I'll just get that infusion.
Okay, thank you so much. Now we move on to Olga Guerrero with El Editor.
Buenos días.
Hi.
Congratulations, Lacey, and the health department for getting the beautiful ladies on board. Bien bonitas mujeres, and I think it's great to have all of y'all to inform and to keep informing the importance of getting the vaccine. One thing that I would like to maybe touch base on and just get the feel of letting the people also know that how important it is to get your second dose. I know statewide that has become a problem. I don't know if it's gotten here in Lubbock, but if we could maybe get some numbers, if there's some numbers, and then get someone or all of y'all to tell us how important it is to get the second dose.
As far as numbers of individuals, we do have lots of individuals in the community that have not received their second dose. Here at the health department, we're doing outreach to those individuals. They're getting postcards, regardless of where they got their vaccine from. They're getting postcards from the health department, encouraging them to get that second dose. One of the, Dr. Gray, maybe.
I can talk about this one too.
Yeah.
So I have lots of patients that get scared of their second dose, especially if they had a reaction to the first one. And we're not talking about an anaphylactic reaction where you can't breathe or something that needs hospitalization, but people who maybe felt really sick, had high fevers, body aches, chills, and whether it lasted 12 hours or it lasted, some say 3 days long. Those are the people a lot of times that are like, man, I can't do that again. I don't want to get my second dose. Well, I would encourage them to talk to their doctor about expectations of that second dose. A lot of times, the second dose is, if you've had a big reaction to the first one, your second dose is really not as bad as that first one. Some people who had no symptoms with their first dose will have a bit of a reaction with the second one. And those reactions are actually good. This reaction means your immune system is waking up and creating antibodies to fight off the infection like it's supposed to do. You aren't actually sick. You can't get the COVID virus from the vaccine. So it's completely impossible. I fight this every year when talking about the flu vaccine because people think the flu shot gives you the flu. This is the same thing. You cannot get it from it, but your immune system is waking up and giving you that febrile reaction, telling you that you are creating antibodies to fight off this infection when you next time see it. patients who have not had their second vaccine are at increased likelihood to get that infection again. I've seen countless patients who only had one vaccine and they end up getting COVID. And now, whether they have as severe of an illness as they would have had, we don't really know. But, at least that one vaccine provided maybe a tiny bit of coverage, but really two is beneficial. At this point, you're hearing in the media about people talking about a third dose even. So let's get that second dose, finish it out. It doesn't matter if you're even outside your window, they give you a window to come back and get that dose. Go back, talk to your doctor. If you're outside it, we can talk about boosting you again, just as we're doing boosters as a third dose to other people. If you didn't miss your window, if you missed the window, literally that they told you to come back to get that dose.
The only thing I would add, I agree with you, Dr. Gray. The only thing I would add is just remember that second dose actually increases your ability to fight the disease. So there's a reason that there's a second dose, and that's really because you are, I think they usually say 60 to 70%, kind of efficacious and covered on the first dose. But with this new mRNA vaccine, especially, and I have my nerd alert is I have a master's degree in cell biology. And so I am in love with mRNA and, all the things about it. And I will tell you that one of the great things with this mRNA vaccines, especially, is that really that second dose is really pushing up immunity higher than we normally see, even with things like the flu vaccine, which we know to be very, to work very well. So you should totally get the second dose.
And again, I'll put in another plug for if you're concerned about misinformation from us here, there, anywhere, those documents are publicly available and you can see the vaccine that you're wanting's graphs of all of these immunities in all the subjects that it was tested in, the thousands and thousands of people collated into a nice little graph, and they label it for you really well. And that 60 to 70% that she was talking about, that's shown on the graph too, and is why I wanted my second dose as well. So if you're scared or unsure, go straight to the source. It's all there for you.
Thank you all so much. Now we're going to move to Elizabeth Fitz with KMAC.
First off, thank you all so much for your time today. I really can't say thanks enough to our medical professionals, first responders, and city officials for all you continue to do to help our community and to keep people safe during this pandemic. I'm hoping you'll talk about the current COVID testing results in Lubbock. Is there a rapid testing shortage, and what is the average time to hear results for people getting tested around Lubbock right now?
I don't know of a local shortage for rapid tests, and the timeline for getting your test results really depends on that test that is being provided to you. Individuals that are getting tested at our Clap Park site, it's about a 48-hour turnaround before we can give you your test results, and that's a PCR test. At a lot of our doctor's offices, they have a rapid test, and they're able to give you results right there in the office, and some of them are able to run a rapid PCR.
We have heard at the hospital when we have folks coming in to both our urgent care centers as well as our ED that, for specifically things like some of the pharmacies and stuff that are offering tests that you can make appointments for, that folks are finding it hard because a lot of those appointments are filled. And I will tell you, I assure you that University Medical Center is doing the same thing, is that we continually are looking at places where we can have more testing available for folks. We do a lot of our testing in children's at urgent care centers, but certainly contact your primary care doc and they can help you understand where to go, for that testing. Certainly if folks are symptomatic, we don't want you coming to the ED to get a COVID test. So I should probably say that I think I can say that for both institutions, that is not the place. The ED is a place for you to come if you're having bad symptoms and you need care for those symptoms, but there are other places that are available for the COVID testing. But I think that that's something that we're continually looking at as a hospital, is to make sure that we have enough adequate places that we can get folks tested.
And just as a reminder to everyone, the Clap Park testing site that's run with the health department and our LRN laboratory with tech is open Monday through Friday, 8 to 1. We'll test anybody that's symptomatic or has been exposed. And really, you don't have to, there's no cost and no appointment needed. So if you're concerned, please come out and get tested.
Thank you, Dr. Thompson. Thank you, Catherine. Next, we go to Christy Martinez Garcia with Latino Lubbock.
Good afternoon, ladies. I appreciate your time. Thank you so much. You know, I'm with Latino Lubbock Magazine, and my job is to make sure that my community is being connected with. And I do want to point out that I had a 7-year-old cousin here in Lubbock that did die of COVID, so COVID complications. So I'm very empathetic to families and children, but as we prepare to, I mean, I know we've been vaccinating children. I do want to point out that 62% of LISD enrollment is Hispanic. And the Hispanic population continues to experience pandemic inequity, as you probably know. And, you know, so what efforts are your respective workplaces making to build awareness, connect with this marginalized population? Because as you know, I mean, do you have culturally competent bilingual caregivers? And I mean, are you making marketing plans that reflect them so that they will feel not a mistrust, but that they can actually count on you guys for treatments and to, you know, as one person said, I don't want to go to the hospital because I don't want to die. So, you know, I mean, there's a lot of folks that still have these types of concerns. So how are you guys handling that? And I know that's a lot of questions, but, you know, it was limited to one. So I had to put it all into that one question. So if you can answer as best as you can, I would appreciate it.
Dr. Thomas, yeah.
Oh, I was gonna say, I'll go
No,
ahead.
please start off, Dr. Thompson.
Yeah, I was gonna say, I'll
Yeah.
start from the hospital perspective. So, Christy, thank you so much for actually saying that and bringing it up, because I do want to say that we certainly know that within COVID that we are seeing some challenges in, you know, some of the different groups of folks that are affected, and certainly also sometimes in the severity of disease and things that are happening. So thank you for saying the question, because I think that it brings it to the forefront so we can talk about it. We actually at Covenant Health, because we have such a close tie with the Catholic Church, we have actually done a lot of work with this, trying to partner with folks from the Catholic Church and things like this to try to help get some of those messages. We have also talked about the need for the things that you said about, you know, competent bilingual folks who can answer questions. And we continually have conversations about this. But what I will tell you is your question is a reminder for me to make sure that we're continuing to ask those questions and to make sure that we're getting that information out to groups who may have some questions, you know, about that, especially groups that are also having sometimes some more severe illness with this. So we will continue to work. We are doing work, but I think that that's my reminder that we need to make sure that we're continuing to do that work.
I would like to throw in something there too. First of all, I'd like to say I'm sorry for your loss, of course. One of the things that I wanted to throw out there is that we have some really amazing, competent physicians, and this is kind of my message to them and any other healthcare professionals, is that don't sit in your bubble, you know, reach out to other communities and other volunteer organizations. I currently volunteer on the board for the Lubbock Children's Health Clinic, which is a nonprofit clinic on the east side of Lubbock. And we serve, I mean, we have bilingual caregiver providers everywhere, from nursing staff to front desk staff, to our nurse practitioners, to our doctors. And I help advise them about ways that we talk about COVID. I've been doing this since COVID pandemic started, and we had questions about how do we talk to our patients, especially children and families, about safety and good practices, and truly trying to understand these things. Other providers, I would encourage you to reach out to organizations that you're curious what their stance is. I've recently emailed out to the La Leche League, trying to just talk to them and see what's their stance, what's their advice for breastfeeding mothers, as that's a passion of mine to talk about. But my thing is, I think that's a great point. We really do need to talk about that and make sure that we empower our healthcare providers, our physicians, our nurse practitioners, our administrators, to reach out to these communities and provide this expertise, because we are all in this together.
Okay, thank you all for that. Next, we go to Ashley Cantu with the Daily Toreador.
Hello, thank you so much for having me. So as we all must know, football season has started, and with that comes large groups. So for my question, are we expected to see a spike in COVID-19 cases due to the last week's football game?
The health department is closely watching all of that data across the state of Texas. We're really seeing the average number of cases flatten out. It's still high, but we're not seeing that increase. But when we start digging down in those numbers, we're seeing the numbers slowly subsiding in our over 40 age group, but we're seeing an increase in those younger age groups. And, football season and all of these are, outdoor events, which is great. We see less transmission in those areas, but, people really do need to be mindful and follow those guidelines and get that vaccine. That vaccine makes it much safer to gather in those groups.
Okay. And last but not least, we have Addison Barthold with KCBD.
Hi, everyone. Thank you so much. Thank you so much for speaking to the public about this. I know it's a really scary time for a lot of people right now. I was just wondering, as hospitalizations and COVID-related deaths are climbing, what can you tell us about the number of those who are not vaccinated? Can this number be added to the current dashboard for the public? Specifically talking about children. I know that's a lot of people's concern. And then I just wanted to get some clarification on the pediatric death number. If y'all could speak on that, please.
As far as what's on the dashboard, we're reporting the number of people unvaccinated that are in the hospitals, and both UMC and Covenant are doing a great job of showing some breakdowns of who's currently in their hospitals. As far as the pediatric deaths, are you okay taking that, Dr. Thompson?
Yes, and obviously what I most know is our specific statistics that are here at the Children's Hospital, and then kind of what it looks like from statewide. So we still have really low numbers of pediatric mortality. So it's a very low number of patients that are actually passing away from COVID. But again, I say that number is not zero. So what we have right now at the Children's Hospital that I mentioned earlier, we have had one death from MISC related complications, and we have had one pediatric death from what I would call acute respiratory COVID pneumonia. And so right now our numbers are still sitting there. Now I will also tell you, we have had to send a couple of patients out of Lubbock because of the severity of their disease to a larger children's hospital. So I haven't followed up, exactly on that. What I would say statewide is that's really statewide in United States, that's still really consistent, that those mortality numbers in pediatrics are very low. But it's like Catherine Wells was talking earlier, when you have more COVID in your community, by definition, you're going to have more hospitalizations. When you have more hospitalizations, that's going to mean more people in the ICU. And the same is going to be true for kids. The biggest reason that we're seeing larger number of kids right now is just because of the amount of infection and things that are in our community, plus it being the Delta variant. So keeping a close eye on it. I don't want to cause panic in people, but I do want to bring, just the fact that we do have pediatric patients that are in the hospital. We do have pediatric patients that are very sick, but those numbers still remain low compared to that adult population.
Dr. Gray or Dr. Bankhead Kendall, do you have anything to add? Is this our last question, Lacey? Okay.
I have something to add, but it's a separate thing that I was just going to.
That's fine.
I'll put in my plug too, from a trauma surgeon perspective too. It's been very, very hard on my group of surgeons as the numbers of cases have gone up in this surge and previous surges, that we are no longer, we have a very big region that we serve, Lubbock, and then many, many counties around us, and we only have so many beds and so many nurses to take care of so many patients. And when those beds are filled with COVID patients, we can't take care of your sister who had a car accident and needs to get life-saving surgery. And I can't accept, maybe your grandfather who fell at a nursing home and has a brain bleed. I can't bring them in to help take care of them when those beds are taken. And even a 20-year-old with appendicitis out in another little small urgent care, I can't help. And so it's going to be delayed access to care for those people. And that's something that is a secondary and even tertiary effect that, we're seeing on the surgery side of things. And you might think, oh, I don't need surgery right now, but you might, and accidents happen and appendicitis happens and all these things happen. And so again, just as a collectively, let's get vaccinated and let's, make these numbers go down. That will all spur on a better community for all of us to be able to take care of you and of your loved ones whenever you need it.
That's what I want to add on to with Dr. Bankhead Kendall is that we, even in the outpatient category on the medicine aspect, we are not able to get patients care that they need. In the past, if I needed certain kinds of medical care for a patient that I can't provide on outpatient on a Friday at 4:30 p.m., that even an urgent care clinic can't provide, it's got to be something that's needed from the ER. I found myself multiple times now not knowing how to do this because the ER has a 24+ hour wait time to get somebody in, or there are 0 beds for a direct admission. I spent a couple weeks ago, I spent a couple hours calling every specialist favor I had, trying to help a patient do something outpatient in just a couple hours left before basically all the imaging centers closed down and things like that, just trying to get them care that traditionally we could have just called over to the ER, had them pop in, get them direct admitted, but we don't have beds for them. And these are medical conditions that have nothing to do with COVID. These are patients that even chose to be vaccinated. These are patients that are super healthy, but just something happens and they need that care that we are now having huge barriers to give this access to. So I just want to encourage people to kind of understand that it's more than just black and white. Do you have COVID or not COVID, or what are the numbers? What are their deaths? Things like that. We've got to look at the big picture, and there's a trickle down effect all the way through healthcare to the outpatient level, to the trauma surgery, to, what happens in the small towns that are unable to get their patients in to see us. We are a huge tertiary center and provide so much care to so many people. And right now we are not able to give that care because of the lack of beds and things. And that's not a slight on any of our hospital systems. They are doing everything they can. It is more just due to the fact we have so many sick people. If we could take out all the sick people that, with COVID, then we may have more bed access, but that's not, we're never going to deny anybody care or, because of the COVID or not. We're going to make sure that we get everybody what they need, but we're asking for the community to help us with this, please.
I actually received a media question and I wanted to ask it since we're all still here. So we have Delta. Majority of our cases are due to the Delta variant. What about other variants? Have y'all seen indications that those are here in Lubbock?
I was actually on a call yesterday with our state epidemiologist, and 98% of all cases in the state of Texas are the Delta variant. The variant reports that I've received for patients here locally tested, 100% of them are Delta. We're always following those trends and that data. But right now, our biggest concern is working with those patients that are now positive with Delta.
The only thing I would add, Catherine, is certainly as long as we continue to have large pockets of our population that are unvaccinated, what we will do is keep the door open for other variants to make their way back into our communities. And that understanding that concept, I think, is a really important thing, because one of the biggest reasons we need to have everyone get vaccinated up to the point where we could have herd immunity is because that's the thing that's going to shut down or at least decrease the amount of variants that could make their way back into our communities. And my last plug, and I'm so grateful that you guys touched on access. I'm a West Texas girl, and so I'm from this area. And I will tell you, a few weeks ago, we had a family member in one of our outlying rural hospitals that we were not able to get to the hospital with a stroke because of bed access. And to your point, Dr. Gray, this is not a slight on the hospitals. This is because, like, legitimately, we did not have the ability to take take those patients. And my last thing I would say is the best way you're going to protect kids who can't get vaccinated, so kids under 12 who can't get vaccinated, the very best way that we can love that population of kids and protect them is for everybody who is eligible for a vaccine to get vaccinated.
Thank you all very much. Thank you so much to our interpreter and to our esteemed Girl Power panel. Very excited that y'all could join us today to give your insight. And for the latest on the City of Lubbock news, please follow our official social media accounts. And in the meantime, be safe and have a good week.